Okay, welcome everyone to our the Center for AI and Society seminar series. It's my pleasure this afternoon wow, I should maybe slow down for just a second as I see that there's people just pouring into the waiting room. Maybe I'll wait 30
No
seconds.
problem at all.
I'll go
No
very
problem at all.
slowly with my introduction.
No.
So, hi everyone. I'm Eric Rice. I'm the director or one of the co-directors of the USC Center for AI and Society. And I also see that we have one of the associate directors, Lindsay Young, here with us. I know that Haley Weintraub, who's our center operations person, is also here. And it's my pleasure to introduce our seminar speaker for this week, who is Frederic Reamer, who has been on the faculty of the School of Social Work at Rhode Island College since 1983. And his research and teaching have addressed a wide range of human service issues, including mental health, healthcare, criminal justice, public welfare, and professional ethics. Dr. Reamer received his PhD in social work from the University of Chicago, which he and I were having fun talking about our shared University of Chicago past. I was only a lowly undergraduate, though, there. And he served as a social worker he served as a social worker in correctional and mental health settings for years. He has been highly involved with national professional societies, especially around issues of ethics in social work, and recently has been writing about ethical issues and challenges raised by AI. And he will be speaking on AI and social work ethics for us this afternoon. So, Dr. Reamer, I turn it over to you.
Thank you so much, Eric. It's great to be here. And I really do appreciate the invitation. I'm not just being polite, I really do appreciate the invitation. So I recognize that, sitting in front of a screen yet again for an hour or so may feel a bit burdensome, but I'll do my best to keep you engaged and leave some time at the end for your comments, your questions. You may have thoughts that are different from mine, which is absolutely fine. I'm a firm believer in the free exchange of ideas. I'm an academician. I take that very seriously. So I hope you can see my PowerPoint on the screen. And I'm going to move through some of these slides fairly quickly. Some of you may remember those, right? I remember using one of those. Yeah, Eric and I both remember. We may be the only ones here who actually remember using rotary phones, right? And I remember typing papers in high school, and I think my first year of college, you couldn't even plug that thing in, right? And I remember doing my doctoral dissertation at the University of Chicago, which Eric just mentioned. I had to key punch my data on these cards. Eric will appreciate this. I had to walk across the University of Chicago campus from 60th Street, which is where the School of Social Work was and is, over to the Computer Science Center with these boxes of cards. And it was February, meaning it was like 37 degrees below zero and the wind is blowing. And then you hand, that's after punching those things with this thing, and you hand that box over and to some lowly undergraduate, probably making $1.10 an hour, and you came back at like 2 o'clock hoping that the job ran. But if the printout was skinny, you knew you had a problem. You had to go back to the keep. And that was considered fast. And oh, how many of you remember your first mobile phone? Remember those suckers, right? Remember the size of those things? Yeah, right. And now we've got artificial intelligence in social work and more broadly, the behavioral health professions. This is a screenshot of an article that I recently wrote on this very issue, which reflects some of my current thinking about this. My thinking is evolving, of course. This is a piece that appeared very recently in a publication um, that is promulgated by the National Association of Social Workers. I imagine we have some social workers here today on the emergence of the use of AI in the social work profession. I have some of my sound bites in this article. Oh my gosh, has the world changed? And when I started my career, I couldn't have imagined any of this. I mean, when I started my career, like the cloud was simply the white fluffy thing in the sky, full stop. TikTok was the sound a clock made, full stop, right? And uh, I, I had heard the words artificial intelligence, like artificial sweetener, and intelligence, like brain power, but I'd never used those two words together. But here we are. And I'm not going to go through the history, but Eric's other alma mater, Stanford University. I think many people credit John McCarthy as one of the key creators of this phenomenon we now call artificial intelligence. And I don't know how many of you know that, but that is nearly 70 years ago. 70 years ago, when John McCarthy at Stanford kind of introduced some of these ideas. In behavioral healthcare, and by which I mean clinical social work, psychiatry, psychology, mental health counseling, marriage and family therapy, substance use disorder treatment, and so forth. These are the various uses I am seeing for clinical interventions, right? Obviously, and I know many of you know this, the use of chatbots and predictive analytic tools, AI generated avatars. There is a program in Kansas that uses AI generated avatars, and the avatars talk to each other, right? And one of them is a client, one of them is the air quotes therapist. AI that's being used in the form of smartphone apps and wearable sensors for client self monitoring. So they can monitor their own moods, their own behaviors, their own symptoms, data that gets transmitted to the clinician. AI that's being used for client surveillance, right? So Eric mentioned that I've spent much of my career working in the criminal justice field. I was on the parole board in the state of Rhode Island for 24 years. AI is now being used to surveil people on parole, people who are being discharged from substance use disorder treatment programs, where they have gamification incentives. That's a great word, gamification. If they engage in certain treatment protocols, they are rewarded with certain incentives that they can cash in. Some of you who are very familiar with AI know the term ecological momentary assessment. AI technology that's repeatedly samples clients' behaviors and experiences in real time, collates this, looks for patterns. Social robots. I recently traveled to Japan, went to a nursing home where there is an AI driven social robot that interacts with nursing home residents. The robot can dance with residents, tell them stories and jokes, engage them in conversation, read emails that come in from friends and relatives. They can place video calls, right? Interesting ethical issues related to the use of social robots, particularly when the clients have some cognitive impairment and may not know that they're interacting with a robot, not a human being. We know that AI is being used for data mining to extract useful information from data to identify patterns and trends using learning algorithms. Lots of jargon here. Again, I know quite a few of you are familiar with that. Jargon, you may know that AI is being used in behavioral health care and the human services for algorithmic forecasting. So, for example, there are several public child welfare agencies that are using AI to predict child abuse and neglect, to predict how people are going to do on parole and probation. There are some public child welfare departments where if a social worker or a mandated reporter calls in with facts or what appear to be facts, the AI will screen all that information to decide whether an investigation is warranted. I'm seeing AI used to populate content for grant applications that are written by social workers and other human service professionals to conduct needs assessments, evaluate programs, to add content to final reports for funders, to engage in advocacy and social justice campaigns, clinical notes. Some of you may know that therapists can use one of several heavily marketed AI tools to generate their clinical notes. As some of you know, a clinician can, with client's permission, record a therapy session, upload that recording to the AI platform, and the AI platform will generate the clinical notes. It's a real time saver, which of course many people find very appealing. But there's also a downside to this, which I'll touch on later. One of the things Eric didn't mention is that I spend an awful lot of my time raising this hand. This one doesn't count. I have to raise this one in legal proceedings, litigation cases, licensing board cases, where I serve, to use the court's term, as an expert witness. Then I do that many, many times per year when social workers and other behavioral health practitioners are sued in malpractice and negligence cases or named as respondents, that's the noun, in a licensing board case. And I know for a fact that clinicians' notes are typically central to those legal proceedings. And those clinical notes in 2024 are going to be projected on a large LED screen in the courtroom in the licensing board hearing. I'm now beginning to see AI generated notes projected on that screen for cross-examination purposes. And some of those AI generated notes were not carefully proofread by the clinician. They were attracted to the software because it's a real time saver, yay, but they didn't proofread carefully, and there were some errors of fact that they now have to admit to under oath during cross-examination. It is a problem. I'm seeing AI used for quality control purposes and to provide clinicians with feedback. I'm going to show you in just a few minutes a resource that some clinical supervisors, some clinical instructors are using to give students, to give supervisees feedback about fidelity. You may know the term, the extent to which their clinical skills match evidence-based clinical practices. And the feedback is generated by AI. As I imagine some of you know, AI is being used in the research realm to assess, to access professional literature, and not just the Google search, but very sophisticated search engines to assess the quality of the literature, to look for patterns in the literature, almost like a meta-analysis, if you will, um, and to teach and to provide agency-based training. I'm seeing AI used to conduct simulations when we're training social work students, psychology students, psychiatry students, virtual reality that depends on AI. As an academician, I will tell you, when students upload their papers on our learning management system where I teach, it's Blackboard. I don't know what they use at USC, but I'm sure it's something like that, if not that. We have plagiarism detection software. It's AI generated to see if there's any evidence of plagiarism. I think one of the great advantages of AI is that there are assistive technology tools for students, for practitioners who have disabilities. AI can be very helpful. Lots and lots of examples out there. And I want to share a few of them with you briefly. For those of you who are not familiar with these, right, I just want to take a few minutes to do this. So, by the way, I want to just say, I'm not endorsing any of these products. Not my job, no endorsements. These are simply examples. In fact, you know what? Let me, because I want to play a couple of little videos here. So I need to click on the share sound thing. Okay, very good. All right. So let me go back to, wait a minute, 1 second here and pull it up with the sound share. Okay. So this is an AI tool called Woebot. Very clever name. I think woe, like woe is me, people who are struggling. Woebot, get it? And this is an AI tool that the general public can use if they are struggling. Okay. This was featured on 60 Minutes. I'm just going to play it a little bit.
What I posed as someone.
Let me just start at the beginning here.
AI is probing that most human of places, our psyches, offering mental health support, just you and a chatbot, available 24/7 on your smartphone. There's a critical shortage of human therapists and a growing number of potential patients. AI-driven chatbots are designed to help fill that gap by giving therapists a new tool. But as you're about to see, like human therapists, not all chatbots are equal. Some can help heal, some can be ineffective or worse. One pioneer in the field who has had notable success joining tech with treatment is Allison Darcy. She believes the future of mental health care may be right in our hands.
You get the idea. We don't have time for me to play. More than that, a few other examples. So this is WISA. WISA is also an AI, a tool that depends on AI. Right here, our AI-driven platform offers personalized care that's always available 24/7, 365, helping individuals, organizations, healthcare providers, and young people. Okay. Then we have Pepper. Pepper is a robot. A Pepper is a robot that a number of health and behavioral health organizations are using to interact with patients, with clients. Then we have Elomia Health, the artificial intelligence that works like a therapist, right? And if we had time, I would walk you through exactly how this works, right? You can see right here a little simulation of the exchange right there. Get it? Okay. Then we have EarKick, your personal AI chatbot. Measure and improve your mental health in real time with your personal AI chatbot. Eloque. Eloque is fascinating. Eloque, and it's really small, looks like that, doesn't look like, a human, right? And as it says here, it can play games with somebody who is isolated at home, in a nursing home, in a rehab facility. You can have bingo sessions with Eloque and video chat. It'll facilitate video chats and all kinds of good stuff there. Then there's this product called Listen. Clever, Lyssn, get it? Listen. And this is an AI tool, as it says, according to them, the only artificial intelligence training and QI platform that uses gold standard evaluation tools to assess and improve fidelity, there's that word, to evidence-based practices, intuitive on-demand training modules. And I've seen this in action. And so, for example, if Eric wants to teach someone how to use cognitive behavioral therapy or dialectical behavior therapy or motivational interviewing or something like that, Eric could, with the supervisee's permission, with the client's permission, record the session, upload it to Listen, and Listen will go through that recording and provide very, very, very detailed feedback about fidelity, the extent to which that clinician in training actually used what the evidence, the skills that the evidence suggests the trainee should have used. Okay, so that's Listen. Then I mentioned that a number of practitioners are drawn to AI tools that can generate their clinical notes as a time saver. So let me play this one for you real briefly.
This is Chloe. She's a psychotherapist who is 100% dedicated to helping her clients in the best way there is. But life is not that easy. Keeping up with documentation is very time-consuming, and time is in short supply. She tries to take as many notes as possible while with clients, but this is not improving the quality of her sessions. And instead of unplugging and spending time with her family, she is working late nights to document her sessions from memory. Chloe remembers a fellow therapist mentioning Mentalic. Mentalic is a new tool that takes notes on its own, using AI technology that's already being applied successfully in solutions for other professionals. Mentalic was tailored specifically to meet the needs of psychotherapists. The tool extracts the most important information directly from session recordings and translates these automatically into progress notes. When using Mentalic, Chloe can fully focus on her clients. All she needs to do is review the notes after a session and approve them, leaving her evenings free to relax and recharge.
You get the idea. And as I mentioned, those notes, in my experience, in a litigation case, in a licensing board case, are going to be projected on the screen for opposing counsel, the lawyer on the other side of the case, to scrutinize, critique. And I'll tell you, the only reason opposing counsel puts those notes up on the screen, the AI-generated notes, is because opposing counsel in a litigation case or in a licensing board case has found problems in those notes, and they want to exploit those problems for their benefit. Everybody knows about Amazon. Did you know that Amazon not only delivers you 13 packages on average per day, Amazon also has a product called AWS Health Scribe, which automatically creates clinical notes from patient-client conversations using generative AI, right? Very much like Mentalic. Now, I actually could have skipped this presentation and I could instead play you this. So please listen carefully. I'm just going to play about 2 minutes of this.
Ever find yourself scrolling through like endless TikToks?
Yeah.
You know, like curated just for you.
Yeah.
Or maybe you've been like kind of amazed by those chatbots that seem, I don't know, almost human.
Yeah.
That's AI in action, quietly shaping our kind of digital lives every single day.
Absolutely.
But what happens when this technology enters a field dedicated to human connection and complex social challenges? Buckle up, because today we're taking a deep dive into the world of AI in social work.
It's a fascinating and rapidly developing landscape.
Yeah.
What's intriguing is how AI, a technology we often perceive as, cold and data-driven, is being integrated into a profession deeply rooted in human empathy and understanding.
Exactly. We're talking about AI being used in crisis text lines, apps designed to support veterans with PTSD, and even algorithms predicting which individuals might need the most assistance from social workers. There's no doubt the potential to help is huge.
Huge, yeah.
But is it really that simple?
That's the million-dollar question.
Yeah.
Professor Frederic Reamer, whose work we'll be unpacking today, doesn't shy away from the complexities.
Right.
He reminds us that AI, by its very definition, involves systems designed to analyze information and react to it. They're trained on massive amounts of data to achieve specific goals.
Okay, I'm seeing where you're going with this.
Yeah.
If AI systems are only as good as the data they're trained on, what happens when that data reflects existing societal biases?
So I'm going to stop it there. And I could just sort of sit back and let that couple who produced that podcast tell you the story. But why did I play that for you? I generated that using AI. Those two people you just heard discussing my work, those are not real human beings. That is an AI-generated podcast. All I did was take one of my articles on AI, I uploaded it to the AI platform, and in about, I would say 90 to 120 seconds, it was a minute and a half or 2 minutes, that AI platform generated that podcast with two people, air quotes, talking about my work. They don't exist. Everything there was generated by AI. Pretty impressive, huh? And maybe also a little bit scary and a little bit creepy, right? But by the way, I did that this morning just for this. Okay, so let's go back to the PowerPoint. So as Eric said in the intro, I've spent much of my career focusing on ethical issues in social work, human services, social services, the behavioral health professions. I chaired the task force that wrote the Code of Ethics for the social work profession. As I said a few moments ago, I do get involved as an expert witness in many, many litigation and licensing board cases around the United States, including, by the way, a number of them in California right now. And so I am especially focused on what I think are the emerging ethical issues associated with the use of AI in behavioral health, human services, and so forth. And I just want to share with you my thinking today. And by tomorrow, this stuff is changing so rapidly. My thinking might change by tomorrow. Who knows? But at this point, I'm focusing especially on 10 issues. And I don't want to read all of this to you, the whole death by PowerPoint problem when you do webinars. I just want to use this to highlight some key issues. And I can send this to Eric later if he wants, and anybody who wants it, be my guest. So I'm focused on what are the informed consent issues here, right, that we need to think about. Now, that's not a new concept in behavioral health. Of course, we've been concerned about informed consent like forever, or not quite, but a long time. And I want to know to what extent clients know how data they share with social workers, other behavioral health professionals, include data in their electronic records. How's this stuff going to be used? Transparency. To what extent are social workers and other behavioral health professionals who use artificial intelligence sufficiently transparent with clients about the potential benefits, and I would say especially risks? Privacy invasion. Is there a risk to clients' privacy when they share personal information with artificial intelligence platforms and tools such as chatbots? Um, Threats to autonomy, not a new idea. But with regard to AI, is there the possibility that there's going to be a risk of loss of autonomy on the part of clients when they are provided services by AI? You know, when they don't have the opportunity to engage in open-ended dialogue with a human being. Do they lose some control over very sensitive personal information that they share? I am quite worried about the possibility of misdiagnosis in clinical settings when we use AI to try to diagnose. Number six, the risk of abandonment. In my role as an expert witness, I get involved in too many cases around the country where lawsuits and licensing board complaints allege that practitioners abandoned their clients, did not provide services in a timely fashion, didn't respond in a timely fashion. And I'm worried about the extent to which these problems may loom large when we rely on AI. Number seven, surveillance. Soon after the United States Supreme Court overturned Roe versus Wade, and I'm not making a political comment here, not appropriate, but soon after the Supreme Court overturned Roe versus Wade, the Dobbs decision that I'm sure many of you are familiar with, I started to get phone calls from clinicians around the United States, particularly in states like Texas, where state law has criminalized behavioral health practitioners' discussions with clients about abortion options. They could be, in my opinion, criminally prosecuted if they help to facilitate travel to another state where abortion is legal. And some of these clients have used AI. Some of these clinicians have used AI in their communications, and that's a database. There's a digital footprint there, which in theory could be used as evidence in criminal prosecutions. If you take a look at Rule 34 in the Federal Rules of Civil Procedure in Texas and Florida, other states with very restrictive abortion laws have comparable rules in their state civil procedures. There are these provisions regarding subpoenas of ESI, electronically stored information. I am now seeing lawyers, prosecutors subpoena ESI, which includes artificial intelligence. Number eight, plagiarism and dishonesty. I already mentioned that, so I don't need to get into that in great detail. But I've seen instances where students, practitioners have basically used the powerful AI search engines. I'm not talking about Google or Bing or DuckDuckGo. By the way, that's not a joke. DuckDuckGo is a pretty powerful search engine. I'm talking about the more powerful search engines, and they find really good stuff like Perplexity and Copilot and so forth, and ChatGPT, of course. And they're copying and pasting without acknowledging that they got these word-for-word passages from AI. So, you know, we have some potential problems with plagiarism and dishonesty. As a social worker, I'm very concerned about algorithmic fairness and bias, the extent to which AI tools can exacerbate social and cultural and political bias as a result of the databases on which they're built. You know, those of us in social work who are providing clinical services to people who are very low income, people of color, and the AI database that's providing advice about how to help them may be drawing on research samples that do not include many people of color, people who are low income. And we know about the possible exacerbation of algorithmic bias. And as I've mentioned, I'm concerned about the implications of all of this. Number 10, in cases where there's litigation, licensing board complaints, and so forth. Okay, so I'm going to talk for another 15 minutes or so. And I just want to talk about emerging ethical standards that I think have relevance to AI. So, as I mentioned earlier, I was privileged to have chaired the National Task Force that wrote the Code of Ethics adopted by the National Association of Social Workers. And several years ago, my colleagues and I were asked by NASW to revisit the work we did on that code, which was in the 1990s, long before anybody had heard of AI. We were asked several years ago to revisit the code and to draft supplemental standards specifically related to technology, right? Before any of this stuff existed. And so we did that. And if you take a look at the Social Work Code of Ethics now, you will see several dozen relatively new standards specifically pertaining to practitioners' use of technology, to provide services to clients remotely, to communicate with them online, text messaging, all that kind of stuff. When we drafted those standards several years ago, we did not talk at all about AI. It was not yet on the landscape or the webscape, right? So as hard as we've tried to keep up with these developments, we still have a lot of work to do with regard to the development of ethics standards that are embedded in codes of ethics in psychology, psychiatry, mental health counseling, marriage and family therapy, social work, and so forth. And I'm working on that right now. So that's one a possible guidepost. A second, practice standards. So also several years ago, 4 major national organizations in social work, the National Association of Social Workers, the Association of Social Work Boards, that's the umbrella group for all the licensing bodies in North America, including Canada, the Council on Social Work Education, which accredits social work schools like at USC, and the Clinical Social Work Association, self-explanatory. Those 4 organizations joined forces, I was told, for the first time in history, for one sole purpose, and that was to develop state-of-the-art, ethics-informed practice standards related to use of technology. And let me see, I'm going to try to pull this up for you real quickly. And so this is what it looks like. Okay. So this is the final product, right? Standards for technology and social work practice. And the 4 organizations appointed a task force, and I was asked to chair this one as well. This was another 1.5 years of my professional time. And this document is 61 pages long. 61 pages long, and every standard in here pertains to the use of technology. The words artificial intelligence are not in this document. And this is a fairly recent document. So we have to update this thing as well. And then the third, let me just go back to the PowerPoint for a moment just so you can visualize this. The third set of guidelines that I think are germane, regulatory standards. So a little over 10 years ago, the Association of Social Work Boards, again, that's the umbrella group of all the licensing bodies in North America, they at ASWB were getting so many requests, not only from licensing boards in the United States and Canada, they were also getting requests from licensing board personnel around the world, asking whether ASWB, which is very influential around the world, whether ASWB had developed any licensing standards, model licensing standards that they could use as a point of departure related to technology use. And the answer at that time, about 10, 11 years ago, was no, hadn't done it. So ASWB also appointed a task force to come up with these things. And let me get it for you. Model regulatory standards for technology and social work practice. So this was an international task force. You can see here, it was formed a little over 10 years ago, which, you know, feels like the dinosaur era now. It's only 10, 11 years ago. And ASWB put together an international task force. So there were people from Wales, New Zealand, Ireland, Canada, you get it. And I was asked to chair this thing as well, you know, And so I've had three major opportunities to help develop technology-related ethics and ethics-informed standards for a code of ethics, the National Association of Social Workers, for the practice standards that were adopted by these four organizations, and also the model regulatory standards that licensing boards around the world use to develop licensing statutes and regulations. And I know for a fact that this document has been used in many countries around the world to address lots of ethical issues related to technology use. This document does not include the phrase artificial intelligence. So again, we still have work to do. We still have work to do. But I think we at least have these lenses we can use to develop ethics standards, to develop practice standards, to develop model regulatory standards applicable to the use of artificial intelligence. Okay? And I've read a lot of literature on this stuff, and I'm sure many of you have too, those of you with a special interest in AI, and particularly the ethical implications. And so this is what I am focusing on right now. The need, in my opinion, to develop ethics-informed policies for the use of AI in behavioral healthcare. So I cite here a publication that I think does a very nice job of laying out, if you will, mandates, ideals. If we're going to develop ethics-informed policies, what do we need to focus on? Governing principles, the establishment of digital ethics steering committees to kind of oversee all these efforts, development of focus groups to get feedback on the ways in which we're using AI, the algorithms, and so forth, right? Creating simulations before we, sort of beta testing, if you will. We've got to develop rigorous training protocols and so forth and so on. So I think this article provides a very nice roadmap for what we need to do. For those of you not familiar with it, there are two major documents that I think can be very helpful. Eric, I'm kind of curious to know whether you've come across these in your work. I bet you have. UNESCO, United Nations Educational, Scientific, and Cultural Organization, everybody knows it as UNESCO. They have what's called the Global AI Ethics and Governance Observatory. If you have time and the inclination, I encourage you to take a look at the stuff they've produced. It's really good, really good. And also what's called IOS, the International Organization for Standardization. This is an organization that's been around a long time. And if you take a look at the work of these two major organizations, I think you've got another really useful set of guideposts, another really useful roadmap, if you will, with regard to the ethics-related issues we need to be thinking about as we develop and implement AI tools in social work, behavioral health, human services, social services, what have you. Focusing on, and this is no great surprise, issues of fairness, to be sure the AI tool doesn't discriminate, right? The algorithmic bias problem. Focusing on transparency, right? So that we ensure that users really understand the implications of their use of AI. Non-maleficence, that's ethics jargon. Some of you may know of the pioneering work of two ethicists, bioethicists, in the 1970s, particularly at Georgetown University. Many of you have heard we call it the Georgetown mantra, right? The emphasis on beneficence, non-maleficence, autonomy, and justice. We call that the Georgetown mantra. Non-maleficence meaning do no harm, right? Making sure that the AI tools we use do not harm people, don't harm the society, don't harm the environment. I imagine many of you have read about the energy consumption, right? That's a byproduct of the use of AI, which the carbon footprint, it's a little scary. Issues of accountability to be sure that AI developers and policymakers ensure that AI is being used responsibly. That's a pretty tall task. Privacy issues, I imagine we're all concerned about. Making sure that we take the steps we need to take to protect users' personal data. Robustness, that's the term that both UNESCO and the iOS use to be sure that the AI systems are secure, doing what we can to prevent adversarial attacks, unexpected inputs, and all that. And as a social worker, I'm really concerned about the last item there, inclusiveness, the development of AI systems in a way that draws on the diverse perspectives of those who are going to use AI, people of color, people from different cultural, religious, ethnic communities, different income groups, LGBTQ plus individuals. I think these diverse groups need to be involved every step of the way. So again, I commend these two resources to you. I don't know how many of you have heard of the concept of AI ethical impact statements. I think this is really important. And if you take a deep dive into the literature, you will find some really good discussions of this concept of an ethical impact statement directly applied to the use of AI. And I'm not going to take the time to read through all this, right? But it's a standard ethical impact statement explores the extent to which the AI tool does no harm, that there is appropriate governance in terms of oversight, that the folks involved in development of the AI tool represent all the different socioeconomic and cultural and ethnic and religious groups that may be using the AI. The focus, of course, on safety and security and fairness and non-discrimination and diversity, sustainability, the impact on the environment, as I mentioned before, including things like the impact of raw material extraction and processing and the carbon footprint and all that. And ethical impact statements also focus, of course, on issues related to privacy and data protection, especially in behavioral health, ensuring that there's appropriate human oversight, that there is a protocol built in. So, for example, if you have a user who's sharing suicidal thoughts, suicidal ideation, there's a way to escalate that to a human being, not depending entirely on AI to respond. Issues of transparency and accountability and issues of awareness and literacy and so forth. Okay, final comment before we open it up. As someone who does consult on many, many, many litigation and licensing board cases around the United States, and I've been doing this for decades, I can tell you that the attorneys who are involved in these litigation cases and licensing board cases always ask me this question. Their wording differs a little bit, but I would say the thrust of it 100% of the time goes like this. So, Dr. Reamer, now that you've had an opportunity to review all of the evidence, all of the documentation, you've interviewed the parties, in your professional opinion, did the fill in the blank, social worker, psychologist, counselor, marriage and family therapist, psychiatrist, whatever, meet the standard of care regarding whatever the issue is in the case, or fall below the standard of care? And during most of my career, the cases I've been involved in have had nothing to do with artificial intelligence. Nothing. Most of the cases I get involved in allege negligence related to management of confidentiality, confidential information, private information, privileged information. Allegations that a practitioner mishandled boundary issues and dual relationship issues, conflict of interest issues. Allegations that a practitioner abandoned a client. Those are the kinds of cases I get involved in until recently. And now I'm getting involved in cases where issues pertaining to artificial intelligence are surfacing. And so what do attorneys mean by this term standard of care? Different states define it a little bit differently in their statutes. But if you line up all the statutes that define standard of care in the United States of America and you boil them all down, you get a sentence like the one that appears here. And the question that I am always expected to answer, always, as an expert witness is, to what extent did the practitioner act in a way that is consistent with what a reasonable and prudent, meaning careful and cautious, what a reasonable and prudent professional with the same or similar training, meaning psychologist, psychiatrist, social worker, marriage and family therapist, counselor, psychiatric nurse, what have you, what that practitioner with that training should have done under the same or similar circumstances. This concept was introduced into US law in the 1890s. I'm not making this up. There's a very famous case called Coombs versus Bede. It was litigated in the state of Maine, and it went to the Supreme Court. And the case involved a dispute between an architect, no kidding, and the architect's client, where the client claims the architect didn't do what the architect should have done in designing the house that the client wanted to build, and the client refused to pay the architect. It was a fee dispute. And this case of Coombs versus Bede led to the introduction of this concept in US law in the 1890s, when, of course, nobody had thought about artificial intelligence by a long shot. And this exact same concept is now wrapped around the questions I am getting in 2024 about the extent to which practitioners did or did not meet the standard of care related to the use of artificial intelligence. This is the measuring rod, and I would argue that it will continue to be the measuring rod. And so for anybody who's using AI, this is the standard you're held to. Are you using AI in a way that's reasonable, in a way that's prudent, careful, and cautious, consistent with the standards in social work, psychology, counseling, psychiatric nursing, and so forth and so on? And did you handle your use of AI consistent with what the Code of Ethics says about the use of technology, what regulatory standards say about the use of technology, what practice standards say about the use of technology, and increasingly, what the professional literature says about the use of technology and AI. That's all part of the standard of care. That's what gets introduced as evidence in these legal proceedings. So the stakes are high. The stakes are high. So, Eric, shall we open it up?
I think that would be great. Let's see it. We have 10 questions in the Q&A. So let's see. I will try to pull one or two that seem like they could be good. Some of them are asking about, can we get copies of your talk? Can we get copies of your article? People are clearly excited about diving into some of these ideas more deeply. One of the first questions we had was, I have concerns with behavioral predictive AI, like for child abuse or recidivism. I haven't seen any studies showing that there are very fine nuances of human behavior, language, intonation, and the influence of cultural, religious, or other social considerations, and how those could be accurately algorithmed into enough to predict very complex human behavior. I mean, it's more of a comment than a question, but I think it's also, maybe, if you wanted to maybe comment a little bit on some of your thoughts about the ethical issues, especially around these predictive tools that are, for example, designating a person for recidivism or abuse.
Mm-hmm. So my opinion, and Eric, please feel free to weigh in based on your knowledge, experience, and skills. So I think we're at the front end of all this. I think we're at the front end of using AI, these predictive analytics for all these different purposes. And if you look at the research, and I think the research is still in its infancy. I'm not even sure we're at toddlerhood yet. I think it's still in its infancy. A PS for anybody who's a doctoral student, great PhD dissertation topic. I'll give you an example. There are several studies on the accuracy of clinical diagnosis, right? When symptoms show up in the chatbot and all that. And some of the studies suggest that the diagnoses are reasonably accurate, But several studies suggest that they're not so accurate. So no great surprise, different studies have produced somewhat different results. And I'm worried about, as we say in the trade, the risk of false positives and the risk of false negatives. Or for those of you who are statistics savvy, sort of the equivalent of like type 1, type 2 errors, where like in my world, where I'm very concerned about recidivism and I'm very concerned about child abuse and neglect, of course, I worry about an AI tool that says, nope, this doesn't rise to the level of a major risk. We don't need to investigate, don't need to follow up. And then the headline in the newspaper the next day is child dead, or somebody who was on parole murdered somebody. And and I've lived in that world. I've paroled people who have committed crimes after I paroled them. I don't like that. And the same thing with child abuse and neglect. So I think this is a work in progress. I'm nervous about it. I guess this is my position. And Eric, I'm curious to know what you think. And of course, everybody else. We don't have time to hear from everybody else. Um, I believe that AI does have the potential to be assistive, to be a supplement to human judgment in all of these high risk areas. I don't think I want to live in a world where I am going to entrust AI 100% to make these decisions about investigating child abuse and neglect allegations, to predict recidivism. I think it can be a very useful tool, but I do think we have to exercise human judgment when we're looking at the data that the AI produces. Eric, what do you think?
Yeah, I mean, I appreciate you giving me a moment of your airtime, but I mean, I think, I've thought about these predictive analytics a lot, actually, and I think while you said that you're concerned about the errors that miss, I'm also concerned about the errors that overdiagnose, especially when what you have in some cases is you compound those errors with errors around fairness and bias, right? So if the data is not sufficiently robust or hasn't been investigated thoroughly, especially for issues around race bias or class-based bias, there have been some concerns that you may have groups who, for example, Black parents in the child welfare system, as an example, who might be overly flagged for potential abuse, and what does that mean? And are we in fact then over policing a group of folks who might be already prone to living in communities where they're being over policed? And so I think that it's, but the other point that you made that I think is really important is I don't think these systems should become a replacement for human judgment. I think that if we can have tools which are helping humans to make decisions that are perhaps more informed decisions or more evidence-driven decisions, that would be great. If what we are doing, though, is we're just abdicating our responsibility to an algorithm, I think that's really problematic. And you had raised a question in your slides, and I think I'll maybe throw in a quick question with you, which is, how transparent is transparent when you're talking about developing a tool that even is a helping tool for clinicians, right? Because if they don't understand, I guess the question is, how much does a person really have to understand in order to make an informed decision? And I don't know that there's maybe an easy answer, but I'm wondering if you've thought about how clinicians interact with transparency or not in that regard.
Yeah, I don't have an easy answer. First of all, I agree 100% with your sentiments. I think we're on the same page. We are. If you take a look at those three sets of guidelines that I helped to develop as chair of all three committees, the regulatory standards, the practice standards, the code of ethics standards, all three of them highlight the importance of competence. That if we're going to use technology-based tools, whatever they are, whether it's Zoom for healthcare to provide counseling, whatever it is, that users should get training and education. They shouldn't just learn how to download the platform and start using it. They need to get training. They need to know the limitations. They need to, in their informed consent protocols and consent decree protocols, be very candid about what the potential benefits and limitations are. Those are both legal and ethical standards. And I'm not sure we're there yet. I think this is kind of the shiny new toy. And I'm concerned that because it's the shiny new toy, some, not all, practitioners are going to find it very seductive, and they're going to start using it without fully understanding the limitations, without being sufficiently transparent. And I noticed in the Q&A, somebody asked something along the lines of, I'm paraphrasing, do MSW programs, and of course, any graduate program in any of the behavioral health professions, have a responsibility to be incorporating this in the curriculum? And I would say, absolutely. I mean, this stuff is here to stay. You know, we've rung this bell. We're not unringing this bell. There's no way to do that. I think in all of the, not only graduate student training programs, but I would say continuing ed programs, because, practitioners, I would say, maybe 100% of them or close to it, they finished their educations at USC, at UCLA, at Cal State, wherever you went, before artificial intelligence existed. You didn't learn anything about this when you went to graduate school. So continuing ed needs to include this as well. And that's a big responsibility, Yeah. By the way, I will tell you, as an expert witness, if you use AI and it becomes part of litigation, expect a lawyer on the other side of the case. And I've seen this happen. Do you acknowledge that you used this AI tool? Yes, I did. How did you choose this one? Did you get any training in the use of this? Did you read any literature about the limitations of this tool? And every answer you provide is part of the record. And if your answer is, nah, a colleague told me about this, so I started to use it, but there's no evidence that you got any training in how to use it. There's no evidence that you took a deep dive into the limitations. There's no evidence that you explained the limitations to your clients. In my world, that increases what lawyers call your legal exposure. Big time.
That's great. I think that was going to be the next question I was going to ask you to address. Actually, I thought that was one that was worth jumping into as well.
Absolutely.
I'm curious if we have, Haley, maybe you can help me with this as well. Was there anyone who was fielding a question that we've missed that is, other than asking us to chime in about how we can get more access to this information, which I think, fortunately, Dr. Reamer said that for one, we will be posting this online so folks can watch it again. He has a number of, he has the one article that's available for folks to read that he's published, as well as these other documents that he made reference to. I think we have a last comment, which is about, let's see here. Are there systems that are able to detect AI-generated reports and clinical notes? Similar, plagiarized writing. So I guess one of the questions is, to what extent is there going to be AI that's detecting AI that's going to be holding us accountable to the fact that we used AI? And have you thought about those issues as well?
Yeah, so I've thought about them, and I am not, all of you who are academicians teaching at USC or wherever you teach, that the learning management systems incorporate these plagiarism detection packages. They're not, foolproof. But I have not seen anything like that tool that is used to assess whether there's like plagiarism or misrepresentation in clinical notes. Frankly, I don't even know how you would do that. But I will tell you this, because I know we're running out of time here. Just a thought for you to consider. For those of you who are clinicians who are thinking, ooh, I love this idea of an AI tool that could generate the clinical notes so I don't have to write them up or type them up. Tell me, please, in a clinical session where a client begins to cry, becomes very agitated and paces around the room, how is AI going to capture the tears? How's AI going to capture the client who's pacing the room nervously? That falls on us, right? AI is not going to capture that. So I worry about clinicians who are going to be solely dependent on the AI-generated notes. I think they're going to be missing critically important clinical information.
Mm, mm. Well, that is a great further cautionary warning, and I think this has been such a thought-provoking presentation. And I know from the comments that have popped up, there have been many who've expressed their appreciation, and I wish that everyone were here live so you could hear a big round of applause, because I know that there are many folks in the audience. But thank you very much, Dr. Reamer, for sharing your thoughts with us, and I hope that you will continue to share your thoughts with us, because as you said, I
Absolutely.
think that we are in the infancy of this issue, and this is something that is going to continue to evolve in the next, really, in the next few years. I think there's going to be a rapid development of what this is all going to mean for our field, and it's great to have you come and share your thoughts. So thanks again.
It's my honor, my privilege, and thank you everybody for participating. I hope it's been worth your while. Be well. And I will
Thank
send
you.
all these links. I'll send all these links to Eric, and he can send them on if he so wishes.
Yes.
Thank you,
Thanks,
everybody.
Thank you,
Thank
Dr.
you.
All right. Bye now.